Hello, I'm Michael Monahan and this is your Adult Acute Pharmaceutical Care Rotation Guideline. What we're going to do today is orient you to the next 5 weeks you'll be spending here at St. Joseph Hospital. What I'm going to expect from you is that you take an active role in this educational experience and contribute to the health care of the patients on your medical team. What you will be doing is identifying and solving drug-related problems, monitor drug therapy, and provide drug information to the healthcare professionals with which you are working. In addition, you'll be responsible for discharge medication counseling prior to patients leaving. On day one, there's a few things I want you to bring with you. The first is the media release form. The second is the hardware-software contract, and last, the technology readiness survey. You may ask, why do I want you to bring these things on day one? Well, the answer is, besides learning about drug therapy monitoring, we're also going to be doing special projects that relate to patient education. And we're going to be using your voice and your video image to generate these materials. So I'm going to need a release form from you. I'm going to need to know what kind of hardware and software you've worked with in the past. And I'm going to need some idea of what technology in terms of software you've used up to this point in your education. Well, what about your rotation itself? What will you be doing? Well, there's a number of activities you'll be undergoing or participating in. They will be inpatient rounds, meetings with me, your preceptor, medical conferences, documenting your clinical activities, some special projects like we just talked about, and the clinical activities themselves. Inpatient rounds, each team rounds approximately 9 to 11:30 or noon each day. And so what you need to do is be familiar with patients on your team prior to the actual rounding with the team. And so what you're going to need to do is look at the current day's drug information from the medical profile, any laboratory values you may need to know, and any notes that the physicians have written prior to round so you can optimize your interventions for the patient care. We'll be meeting periodically, mostly every day, but that time will change. So the preceptor meetings will be varied based on the day of the week and the time of the month, but we'll meet virtually every day. The medical conferences generally are just on Wednesdays in the Morrison room, but you sometimes meet with the rest of your team on Thursdays as well. If your clinical interventions are not documented, they are said not to occur. So all your clinical activities are going to have to be documented. What activities are we talking about? Well, what you're going to do is look for ways to optimize patient drug therapy and intervene with your medical team to optimize the drug therapy each patient has. We're going to do informal case presentations throughout the month, and then you'll have a formal case presentation at the end. This formal case presentation will require handouts and PowerPoint slides. I want you to get familiar with the grading process and the adult pharmaceutical care rotation evaluation sheet we use so you can help define your own grade. It is a behaviorally anchored rating scale so you can see what behaviors are that I'm looking for in order to justify an A or a B, etc. You will have to do a site evaluation at the end of this experience. There's some comments about dress and attitude I'd like you to look at, as well as confidentiality. All this is coming off the website, so please go to www.michaelmonahan.org and read the syllabus and look at the links and make sure that you come prepared. And on that first day, besides bringing those 3 things, the media release form, hardware software contract, and technology readiness, bring any questions you may have and I will address them then. Thank you.